Alrighty. We're just standing here posing, showing off our new shirts, courtesy of Teresa Fisher. I'm just very proud of them. As we wait for people to show up. When people start showing up, we'll sit down. What do you think?
Okay.
Okay. Oh, there's some people.
Who's here? Oh,
Hi, Shonda. Oh yeah, you need to get connected. We're showing off our new shirts in case you're just joining us now. Because they're really funny. Joining us now. Oh, there we go. All right. Oh, here we go. People are coming in. All righty.
Dr. Griner's on.
Oh, fun. Look at all of you.
Oh, sorry.
Welcome. All right. Well, we are. Yes. This is what we do. We get steamy. We are old now, too, so that's
We are.
This is probably hot flashes. Is this what they feel like? I don't know.
I've had hot flashes.
You have?
Yeah, yeah. After the twins were born,
Oh,
like
twins.
my hormones went haywire, and I had hot flashes and night sweats, and the whole it was horrible.
Oh, that's not good. I think they want to hear about like hormonal issues. This one time.
This one time was terrible.
Okay, so we will go ahead and get started. It looks like we've got people connecting with us. So thank you all for being here today. I'm Jen Bacani McKinney, and I am the Wilson County Health Officer.
And I'm Destiny Wheeler, and I'm the Health Department Administrator. And we started out, for those of you who didn't see our shirts, Teresa Fisher sent us a little care package to Jen's office the other day, and had these fabulous practice safe six.
Practice
6
Safe
feet.
6, everybody. That's
So,
some good stuff. That's good advice in general for life.
yep.
Safe 6. Okay, so we will start off with our numbers, right?
Yes.
And as always, we have our little plexiglass thing here so that we're being nice and safe, just in case anyone's wondering. Look how nice that lines up. It looks like we're in a different room.
It does look like.
We're so
We couldn't
fancy.
even have to have a plexiglass
Yeah.
liner. We just look like we're in different rooms.
All right, go for it.
So, numbers for Kansas as of yesterday, because we get these 3 days a week now, there are a total of 28,876 confirmed positive cases in the state, with 365 deaths. And we still aren't getting recovery criteria because they still aren't happy with the reporting levels. So yeah, we
Hold on, I'll
have
check that.
those. Sorry, someone just knocked on the door.
It's just Chris Marple.
Oh.
Nobody cares.
It's Chris. He tried to get a hold of me earlier today, and I was at the school.
Oh, there's Teresa. Teresa, we have your shirts on. Okay, just showing you. All right, go for it.
And as far as Wilson County, if you look at the state's map, it is incorrect. It is saying that we have 10. We do not. We just made it to 9 yesterday. We got 2 new cases yesterday, and so we're at 9. Those are our 2 only active cases. So everyone else has recovered, fortunately, and I don't. Gotta go, but she wanted to see him.
Okay.
But yeah, I don't have the total number of negative tests for the county right now. We've been at school doing enrollment shots all day, so
Yeah.
just rushed back.
Which is actually very important. As we're going into the fall season, we're going to have flu, we're going to have all kinds of the same respiratory viruses we have every year. So our advice to everybody is, if you've never gotten a flu shot before, get your flu shot this year. If we can take out the things that we can control, that's going to be the best thing, because we're going to have plenty still that we can't control. So you might as well get your flu shot. They are not live viruses. They will not give you the flu. They're very safe. So many flu shots have been given for years and years and years and years to millions of people. So let's do that so that we can make sure that that we don't have to worry about the flu on top of getting coronavirus.
Yes.
And Cassie says 604
Negative tests.
negative tests. All righty, great. So we do want you guys to ask questions along the way, so please feel free. We know there's a lot going on right now. The biggest thing probably are questions about kids and reopening schools and things like that. We don't have all the answers. We also don't have a crystal ball. We would like to be able to tell you that everything's going to be fine and that we are, going to start school in person and we'll just stay in person school. We don't know that, but we do know that everybody, all the schools, all the public health officials, everybody's working together to try to get schools open as safely as possible. So that is the one thing we do know about life right now, is that our children, which leads to our children's parents and grandparents or whoever's taking care of them, and our communities are really our biggest concern right now. So we're trying our best. We're trying to figure it out. Now, having said that, there are some cases in other states that have already opened schools, where they're showing that they reopened and then promptly had some outbreaks happen. And so that is a possibility. We know that that's something that can happen. Our schools should be prepared for it. Here in Wilson County, they absolutely are. We know that they have hybrid options available and virtual options available. If you don't feel comfortable at this time going straight into in-person school, there are remote options. But like I said, they're trying their best with being able to keep the schools open, get those kids to be able to interact with each other, like we know is best for their development, but to do it in a safe way. So that's where we are.
Yeah.
We do know there was there was more information about another country that had started school back in May, because other countries might have a different school year than what we do. They opened up maybe when they had a lot of cases going on anyways in the country. Unfortunately, they have hundreds of thousands of contact traces to do, I guess, at this point, and they had to shut down like 1,000 schools. So not that they did anything wrong, but it's just to show that people are trying, things are happening, and then they're reacting to it, and that's the best that we can do along the way.
Yeah.
What else, Des?
Oh gosh, all we've been talking about.
Flu shots.
Yeah. So for the first time since I've been at the health department, they are actually recommending that you wait until the end of September to start getting flu shots. Every other year, it's been as soon as flu shots, as soon as you get them, give them. But this year, for some reason, I think it's ACIP.
I do not know.
Might be recommending. I can't remember. I think it was ACIP. Late September to start giving flu shots. So. Not too far off from where we usually start anyway, but they're recommending not getting them in August right now. And I just found out today that the health department's getting our first shipment of flu shot on the 19th. So
great. Looky there.
Yeah.
All right. And we will, we're going to have lots of options for flu shots this season as well. Drive-through flu shots, which the health department does. We'll be giving them through our clinics in our parking lots. We're still doing parking lot visits and curbside visits. So we'll have plenty of ways to keep people healthy and safe while still getting their flu shots. And if you didn't get the message earlier, don't forget to get your flu shot. I don't know if we said that already a lot.
Really, all of your shots.
Yes, all of your shots.
Get all of your shots. Get your flu shots, your pneumonia shots, your shingles shots, everything that you need. Get them.
Wonderful.
Those are still not good diseases to
And
get.
really, one of the things we worry about is kids. Parents are not getting their kids in a timely manner necessarily for all of their childhood immunizations. So we do need to be careful with that, because there is still whooping cough, and there is still, what are some of the ones that we see? Measles, yeah.
Not here, we've not had measles, but chicken pox, of course.
Yeah, so make sure to get the kids in to do that. Again, we want to minimize kind of the confusion of all the things that are out there this season. So we've still got people with allergies. We've still got your common colds. We are testing people every day here in Wilson County. We're mostly doing the antigen testing with the Quidel test. At this point, the data is showing us that they are 96% sensitive, meaning that they are very unlikely to be show a positive or a false positive, but still that's a positive. They're very unlikely to show a false positive. They still have a chance of showing a false negative, but really they're very accurate tests. So that is very good. We're very lucky. We still hear of places around Kansas and around the country where it's taking up to 2 weeks to get results. So we're very lucky in Wilson County to be able to turn around tests pretty quickly.
Yep.
So thank you to our hospital staffs that are doing that. It's really been beneficial.
It is, and it is a lot of work for them. They work very, very hard. So if you know laboratorian,
a laboratory, a Labrador. I think that's what they're called.
Someone who works in the lab in Fredonia or Neodesha.
I think it's a phlebotomist, but
that's someone who draws blood.
Well, yeah, but they're the ones that are in the lab. Yeah, let's go with Labrador or Laboratorian.
I don't know.
People aren't arguing right now in the comments.
Either one's fine.
Yeah.
So if you know one, tell them thanks because they're working their tush off.
Yes.
Right now.
So one thing that's I think important to know is we have seen the numbers kind of level off in Kansas over the last couple of weeks now. So not to say that our numbers are down necessarily, but we aren't seeing that steep rise in our numbers at this time, which is wonderful news again for opening schools and all of that. Probably the biggest thing, because we haven't had other interventions, we don't see that the virus is affected necessarily by warmer weather, but how about this really cool weather? This is nice.
Oh, it's been so nice.
It's like fall weather. So we don't believe that the virus has mutated necessarily or anything like that. So we really only see masks as the biggest intervention that possibly could be causing that stability of the numbers that we're seeing of cases. So we are testing more. Oh, Sandy says they're lab rats. That'll work.
That works.
From a lab rat. So we are seeing more of stable numbers anyways, not trending up quite so much. But remember that can change very quickly. Not to be scary or anything like that, but we also, we're coming down after our stay-home orders, and then we just came right back up, after people kind of were out and about. And understandably, everybody kind of wants to be doing things, but it caused our numbers to go up significantly, just in the last month or so.
Yeah.
Go ahead.
I was going to say, we need to remember when we're talking about numbers and then going down, that what we do won't affect us for another week or two. So us seeing the numbers evening out now is reflection of what happened a week or two ago, or 10 days ago generally. But so what we're doing now won't affect us for another week or two. So it's really easy to get complacent and be like, oh, well, we don't have any new cases right now. So you go do something, and then there's no immediate result from that. So I think that's kind of...
Yeah, that's where we don't want people to say, oh, good, we're finally out of that peak or out of that increase in numbers. Because that's when we start seeing the numbers go up some more. At this point, I believe, but we haven't calculated it for a little while, but we're still only around 1% of Kansans that have been infected with the virus. And so that's important to know, because again, we talk about this every time. We know that herd immunity with a virus like this isn't going to happen until we're at about 70 to 80% of people being infected in a population. So if we're only at about 1% right now, then we have a long way to go. And knowing that people are dying from this disease, and we hear a lot the argument, well, 98 or 99% of the people who get it don't die. I mean, it's the same as 100 people getting on a plane and saying 2 of you are not going to make it, you're going to die on the way to your destination. I mean, it's a scary number. So 2% is a lot. In any given flu season, 0.1% is more of our number. So you can see how that's still a big deal. So 2% is always a big deal if it's someone you know or somebody you love. And so that's why it's so important for us to protect our families. So one thing I was going to say, Des, is, I think, you know what, do you want to talk about that, and it'll kind of go into what I was
Yeah, there was a question about what about pre-K and mask wearing. The mask mandate technically is children over 5 and over, right?
I believe so.
I think. But we know that kids under 2 shouldn't wear masks. So if your school is saying that your pre-K kid needs to wear masks, it's not going to hurt them any. They are probably going to fiddle with them. They're probably going to get annoyed by them. I've gotten more used to wearing a mask in the past 3 months. We'll say 3 months. I don't fiddle with mine as much as I did, but I did. It's hard to not mess with it if it's slipping down or if it's twisting in your ears. So I think it's okay for pre-K kids to wear masks. It's not going to hurt anything.
So I will say that probably the most important thing that you can do for your kids right now, I guess I'm going to say two most important things. Number one is wear your own mask, because if we as adults and parents and community members don't stop the spread or decrease the spread of the virus leading up to school, then our kids are going to have so much of a lower chance of success in being able to stay in school. So we ourselves need to wear masks and social distance and avoid large gatherings. And then number two, the second most important thing, or equally most important, is that you should help your own child or students learn how to wear a mask now. Because if you are like, I don't like masks, nobody likes masks, right? But if you are saying all day long, I don't like masks, I don't think we need to wear them, blah, 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 and then they're thrown into a situation, the schools, where they have to wear a mask, then they are going to get in trouble for fiddling with their masks. They're going to get in trouble for not following the rules. So these are the cards we're dealt. Nobody wants your kid to wear a mask. Nobody wants you to wear a mask because they're just not fun, right? But we do want your kid to wear a mask, and we want you to wear a mask because they're safe. So set your kid up for success now. Give them a chance to prove that they can do it. Get them used to it. Get them a fun mask. Get them something that they can own and enjoy and decorate, so that they don't feel like it's a burden. Don't feel like it's something that's hard to do. All their friends will be doing it. So please, as best as you can, talk to your kids. Prepare them to be successful in school, and make the mask just part of school supplies.
Yeah, I saw Mr. Fisher actually posted a little how to train your kid to wear a mask. Mm-hmm. I've seen posts on Facebook where kids were like, your parents were saying, oh, you can have your screen time now, you can play on your tablet now, but to do on a screen time you have to have a mask. So it just gets them used to it, because they're not going to give up their screen time. I mean, if they're like my kids were, they're not going to give that up, and if they have to wear a mask to do it, they're going to do it. So that's a good way to kind of get them introduced to it and get them more used to it, because it really is just getting used to it for the most part.
Another thing is, as we talk about, one of the biggest questions I hear is, are masks safe for kids? And there are 0 studies that show that kids 2 and above wearing masks have any negative effects. People are going to ask a lot, like, well, can kids with asthma wear them? Actually, yes. I don't think every kid who has asthma should be exempt, quite honestly. There are different degrees of asthma, mild to severe. That's just the reality of it. And in fact, we need to be able to protect those kids as much, because they do have an underlying disorder. So they themselves probably should be wearing masks. We talk about kids with anxiety. Can they wear masks? Well, really, there is nothing to say that they can't. Again, getting them used to it leading up to school is probably going to be your best bet. Not to say, well, you've got anxiety, so let's go to your doctor right now and get you out of wearing masks. That's not really the answer, because if we have everybody exempted, then that's just more risk for spreading disease. And no one in the medical community wants to be a jerk about it, quite honestly. We just want people to be safe, but we don't want it to become a thing where everybody is trying to get out of wearing a mask. It's not about loopholes. It's not about getting out of things. It's about safety and keeping the next person's kids safe as well as your own. So that's my plea for now. We do, and that's not just me. Like our medical community throughout the state, in Kansas at least, we've talked about this quite a bit and have said, as a medical community, we aren't just going to exempt everybody who walks into the clinic to say, hey, I think my kid needs an exemption. Now, there are definitely cases where exemptions are in order, and we will work with them on a case by case basis. But again, it's really just all about safety in the end. Mm-hmm.
So, Vicki, thank you for trusting us, and we always try to be like as honest and forthcoming as we can. And she asked if us and our families wear masks everywhere we go. I've missed a couple of times. There's been a couple of like I did today. I was in the school all day with a mask on all day, which I will say most people who came in and enrolled their kids were in masks. Most of the kids were in masks. And I walked to Casey's to get a pop, and I left my mask so I wouldn't have to carry it all the way to Casey's, not thinking about having to walk into Casey's. So I walked into Casey's real fast, got my stuff, and I left. But
it happened.
I really try, and I think that's that's our plea to everyone is
Please
just
try.
really try, because that's all we can really do. And the more you do it, we're in kind of a different situation than a lot of folks. We're the ones with our faces on Facebook saying, please wear a mask, you know? And so when we don't, it looks especially bad. So, I really try. I really try and make my kids, every time I'm with them, I can't control what they're doing when I'm not with them. But if I'm with them, they wear a mask. My husband wears a mask, unless he, it's very few and far between that we don't.
And then he gets in trouble if he doesn't. Look at Destiny. She's terrifying.
So mean.
Look at her. So we understand. I mean, people do forget, and hopefully nobody's throwing things at Destiny at Casey's as she's running in and out. But so be kind to each other, as we say all the time. Be kind.
Yeah, and it's probably me that notices it more than anybody else notices. But
Right.
I just am very cognizant of that.
Yeah, absolutely. We also know recently there have been studies out that have said, okay, maybe kids who are 0 to 9 years old don't transmit the virus quite so much. Well, then, just as we are gathering data, constantly, then we have more studies that come out of a camp where there were hundreds of kids there, where kids did transmit the virus pretty readily amongst themselves. And so as you hear this different information, if you're well, Jennifer said last week that the kids are not transmitting the virus. That's true. I did say that a couple weeks ago and a week ago, because that was the data that we had to work with. And then as more data is gathered, we will be completely transparent with you and completely honest with you and say this is the new data. It's kind of like, when we talked about hydroxychloroquine at the very beginning, we talked about antivirals and stuff. Our data is constantly changing. We are learning from people in real time. We're learning from other people in other countries, in other states, and that's the only science we have to go by at this point. So no wonder it's constantly changing. Hi, Maggie.
Berdine asks, should a family who has visited 4 other states stay in quarantine for 14 days? It depends on what states. Right now, Florida is the only state that is under a travel mandate. But I will say that with the caveat that there is no physical boundary between Kansas and other states. So if you're traveling widely and you're doing those kind of, going all over the place, 4 different states, you can quarantine. That would be nice.
That's one of our other shirts. When in doubt,
camp out. Yep, that was one of our older shirts. But technically, they don't have to unless it's Florida. But it would always be prudent to do so.
One of the common questions I get is, let's say that Destiny tests positive. And then so her husband, Jason, would it be beneficial for him to go out and get tested then to see if his test is positive? And we've kind of covered this a lot, but the answer is no. You still have to be in quarantine, even if so let's say he does get tested and he's negative, still has to be in quarantine for 14 days until after either Destiny has recovered or his last contact with Destiny. And so even with a negative test. And we don't recommend testing right away because it's just a snapshot of that time. So he may still develop symptoms, at day 12 after exposure to Destiny. And so, we really we can't rely on just testing everybody who's had who's been in direct contact with a positive. And that's why, because we're seeing symptoms like we talk about. Those symptoms may not come on until 14 days after, until after you have been exposed. So
yeah, and we've seen folks that have been quarantined test negative 1 or 2 times, and then 3 or 4 days later they start having symptoms and test positive. So that's why the reason for the quarantine, Diane took a supply of free masks to the thrift shop and got in there and realized she forgot her own mask. So it's not just me. It's not just me.
Another thing that somebody brought up to me that they wanted to address was some people are saying, well, the deaths from COVID are just being lumped in with deaths from influenza. Have you heard that much? I've heard that a little
I've
bit.
heard of deaths or I've heard people talking about deaths from different things getting attributed to COVID.
Sure, yeah.
But not specifically influenza.
So right now we don't, we are not, have we seen any flu around here yet? Actually, I think, well, I don't know.
Not recently.
really.
I
Not
don't
recently.
think.
So
like in the beginning we saw some.
Yes,
because it was back in March.
Yeah, but like for the new flu season.
Yeah.
So first of all, like flu has not been happening around here, right, for a while. And then for the other things, like when we attribute COVID deaths, when we say somebody died of COVID, it's very rare that someone would just die of COVID, right? Because they end up getting pneumonia, or they end up getting renal failure or kidney failure, or liver failure or something like that. So because of COVID. And so then people might say, well, they actually died of renal failure, but why did you call it a COVID death? Well, would they have been in renal failure had they not contracted COVID? Those are the kinds of things that we're dealing with.
Yeah, it's like hardly anyone dies of AIDS.
Right.
They die of the common cold.
Yeah.
Or because they have AIDS. Because they have AIDS.
Mm-hmm.
No, most people don't die of the common cold, but if you have AIDS, you can. So it's a complication of that disease.
Yeah. So I just wanted to clarify. I don't think, and Destiny and I believe are big. I think we're just thinking alike now these days. So hopefully this is right. I can feel her brain waves through this plexiglass right here. So we're not conspiracy theorists. We believe that everybody is trying their best in the world, and that includes everybody, because we are all in this together. The world is all in this together, and so when we ask people like the state, and they tell us, yeah, even if you test positive twice, we're only counting it as one case. I mean, we ask direct questions to the state, they give us direct answers. We have no reason not to believe them. And so as science is leading us along, we are doing our best to just go by the science and go by what how people are best classifying what's happening. And so that's why we talk about deaths, and we talk about some of these things that might be a little, people might think they're controversial or whatever, but really we're just going by the best data that we have, and nothing more than that.
Yeah. And sometimes that data changes, and then we have to kind of change direction. It's a fluid situation.
We're learning as we go along, right? And like never in the world have we had to learn on the fly so much. Like day by day, week by week, we're getting new data, and it's hard to keep up with stuff. But that's what we're here for you also, is to read all the stuff that you guys don't want to read, and learn about all these studies, and try to give you the best information possible.
Yeah.
Do we have any questions?
I am not seeing any.
Man.
I've seen those couple at the very beginning, and that was it.
We, just in case you missed the beginning, because I think this is a good time to also give this solid advice one more time. Please always practice safe sex. Hello, Michael. All right. Do you expect positive tests after the rodeo? How far out are we from the rodeo?
Actually, yeah, we've got another week.
Oh.
So I want to be very honest and say we always expect positive tests after anything. After
4th of July.
After Memorial Day, after rodeo. We'll expect them after homecoming. We expect them after a church banquet. Any graduation. I mean, there were a lot of graduation parties last weekend.
Mm-hmm.
It could be, anything where people who aren't normally together get together. We always expect cases. We try and plan for those things. At the health department, especially, there's only a few of us, so if there are a lot of cases, it gives us a lot of work. Mm-hmm. So we're hoping to start doing in-person WIC appointments again. To get back to a little bit of normalcy there. But we decided to wait until 14 days after the rodeo, just in case, so we can keep an eye on the numbers. And that is really, I think, the most important part of what we look at is, okay, what happened? And then we have 2 weeks to figure out if it made a difference, and then we can move on. So it's always looking. We never look at what's happening right now.
Yeah, it's always looking back.
Yeah,
and waiting for that 2 weeks to come up, and hoping that everything is okay.
Yeah. So I hope to not see any positive cases from the rodeo,
Yeah,
but
absolutely.
we're always expecting them.
Yep. And that's a great point. Anytime people are together that aren't normally together, these things can happen, you know. So that's why it's so important. And it's not to say that people can't do that, but people have to do it in a safe way with masks. And being outside is helpful, but you have to be outside and socially distancing. And if you can't do that, then wearing masks. So it's not just that we're outside so everybody's safe and we can be close together. It's we're outside and we're socially distancing, so our risk is very low. And when we can't social distance, we wear a mask.
Yes.
So, but yeah, there are ways definitely to be safe through all of that. And truly, it doesn't matter because we're Wilson County. We have we love our festivals and fairs and rodeos, Sausage Fest, which is put off till next year. We love all of these things. We're very social people here in Southeast Kansas. So we're always going to have something. So we can't wait until there's not an event. So we have to rely on our community to do the things that they need to do to stay safe. And like we said, the same things over and over, social distancing, wearing masks. And we sound like broken records, but that's literally the only thing that we have that has shown a decrease in spread. Like really out of everything. All the technology in the world, all the medications in the world, the only thing that data and science has shown us is that masks and social distancing have helped to slow the spread of this disease. And that's it. So that's why we say it a lot, because it's a thing.
Yeah. When just a little health department insight, we practice, we drill, we prepare, we do all these things for pandemics. We have done it all the time since I have been at the health department. I'm not going to say exactly how long it's been, but it's been a long time.
That's not possible. You're only like 24.
I know. I started when I was a teenager. but the most not frustrating, but the hardest thing about COVID is that there's no way to fix it. You know, in all of our drills and all of our training and all of our practicing, there's always a vaccine, or there is a cure, or, you know, you give antibiotics, or, you know, we call them pods, points of dispensing. We practice them over and over and over, but when you have nothing to dispense, except for information, it's harder. It's harder to sift through all of that stuff, and so, like I said, it's an interesting pandemic, I guess.
Yeah. And just kind of speaking of like our local resources, here in Wilson County, like Destiny talked about, I mean, we've got a small amount of active cases. And our hospitals are not overloaded at this point, right? So, but just a reminder, we don't have ICUs at our 2 hospitals here. We do have ventilators. I don't regularly manage a ventilator, and so I don't know that you want me to. I will, I know how, but I'm not a pulmonologist or an ICU doctor, and neither are any of my colleagues in our county. So what we do is we look to the other hospitals around us and what are their ICUs doing. And we're seeing the hospitals in Kansas City and in Wichita, Joplin, we're seeing them be overloaded. Just a couple weekends ago, we were trying to transfer a patient to Wichita to one of the hospitals, and they said, no, we can't take any more people. And they were doing that at KU Med as well. So it's a real thing that if those hospitals are getting overloaded in the urban areas, that directly affects us, because that means that we have to find another place to transfer a patient, or they stay in our hospital. And again, we have fully competent staffs. They've been training for this the entire time, for months, brushing up on ICU skills that they wouldn't normally get by working with other ICU nurses and working with our ICU colleagues. But in the end, we want people to be where people are trained to do this. You know. What else? Other questions? Other thoughts? So we're just filled with all kinds of knowledge.
So much knowledge
these days.
We can't even hardly sift through it anymore.
And as always, you know, we love doing these Facebook Lives because we want to answer whatever questions you guys have. Destiny didn't love it at first, but look at her. She loves them now.
Okay.
But we know that we take everything very seriously. We don't want to take ourselves too seriously because life is way too serious right now. As Diane Hyde is pointing out, if you can do a colonoscopy, you can operate a ventilator. I can scope the heck out of a colon, let me tell you. So, but no pun intended. But it's a different hole, Diane, it turns out. So
you don't want to pump them full of air there.
I mean, you do have to put air in there.
You do,
but not the same kind of air. It's different air. Anyways, so in saying all of that, we know there's so much serious stuff going on in the world that we try to offer as much serious information in a less than always serious way because life is hard right now for everybody. We can still laugh together and keep each other afloat. When are we going to be able to go to the hospital without all the precautions? Barbara asked. I don't know. Not anytime soon, Barbara. And, people ask about, because we're still doing one visitor at the hospital. Everybody has to wear masks to go in. And our assisted living and nursing home facilities, everybody's trying to work hard to get visitors in there. And they're doing a great job. We talk with them regularly about what they're doing. They ask advice. We ask advice. I mean, of them, just great communication. We know that people need people to get better too and to stay well, like in our long-term care facilities, and we're trying our best with that. But right now, we're still trying to minimize exposure to patients that are already sick, so that's why that's why it's required to wear a mask in the hospital. That's why it's required when you come in to see me in my clinic or in any of the clinics that you have to have a mask on. And we do ask as providers that you continue to wear that mask in the exam room because I don't want to give you anything and I don't want you to give me anything because I've still got to take care of lots of people. So please remember that even your doctors and nurses and everyone else at the hospital, you're checking people, that they're just trying to stay safe too.
Yes, and exactly right, Mrs. Githens. Shout out to Eve and company.
Yes, and don't yell at Eve if she tells you to wear a mask. She's just doing her job. Be nice to Eve, please. Let's see. Screening people going into the hospital. They're awesome.
She was, I think.
Oh, screen. Oh, I gotcha. Okay. So so thank you to everybody who does those jobs, and it's similar to people who are trying to get people to wear masks going into businesses. That it's their job to do that, but it's not their job to make the rules. So be kind to them as well. Was there a question?
Okay, so there was, what medication are you prescribing for COVID-19 patients? Have you had one?
No, so we have not had one that we're treating specifically for COVID-19 here in our hospitals. So at this time, the treatment for COVID-19 in the other hospitals is really supportive treatment, treating the underlying condition, like the pneumonia that results from COVID, or like we talked about, liver failure, kidney failure, those things. So we're treating the things that are caused by the body being hit by COVID.
Yeah. So here in the county, we have not had a serious illness result from COVID. So people have been ill, but they've not been hospitalized. They've been able to stay home and take care of themselves and be okay. So in that case, no one is recommending treatment.
Right.
So the only people that are getting specific COVID treatment are those that are very, very ill and in a hospital and generally on a ventilator or something like that.
So people who might be at home, though, they might be treating their symptoms, like with Tylenol or something, to help with the body aches and things like that. And some don't even have that, or maybe they have a sore throat or runny nose. So they do the things that they would normally treat a sore throat or runny nose with.
And then ECMO?
What do you think about the ECMO compared to ventilator? And so those are kind of different things. So you're going to use a ventilator for something, and you're going to use an ECMO for something. And so an ECMO has more to do with with the heart and all that. The ventilator is strictly to keep the patient breathing. So both tools that are used in the ICU, but not necessarily one over the other. Sometimes they're used in conjunction with the other. It depends on what the patient has going on.
Vicky likes the curbside visits.
Oh, good. I thought of something right before we started talking about. I can't remember. Screening people in masks. Oh, yes. Just remember, okay. See, this is where you guys. This is the bad thing about Facebook Live. Like, they're watching us try to make our brain
out
work.
what we're talking about.
Working, the hamsters. So one thing that I want to remind everybody in Wilson County is that that our county commissioners and we as a team, I will say we as a team as the county health board have they issued a resolution to say that masks are strongly recommended, which I want to make that really clear that that's not to say that either masks are mandated or don't wear masks, because we are still there. They might not be mandated, but they're very strongly recommended. And so like when I recommend diet and exercise to somebody, I want to make sure that they are doing it. I can't mandate them to go exercise, but I will strongly recommend it, and that means I fully expect you to exercise kind of the way we talk about it, and do your best to do that. So please remember that, because strongly recommend is not the same as do not wear. And I think we all are, again, nobody likes masks, nobody wants to wear them, but we want to remember that that's still the recommendation of the county, and there's not a single county in the state that doesn't at least strongly recommend masks. Every county in the entire state of Kansas. Now, some did mandate masks, but everywhere it's strongly recommended. So please do remember that.
How are we swabbing patients? Do you have to have an order or call in somewhere? You don't have to have an order now. You should call a hospital lab before you go. And I think they come right out to your car and swab you. Mm-hmm. Right now, we're doing nasal swabs, right?
We are doing nasal swabs, yeah, nasopharyngeal swabs.
So not this one.
Oh, I think we are still. Are you with
still?
The antigens? With the...
Oh, are they nasopharyngeal?
Yeah, I think they still are.
Never mind
they're
then.
Still.
Never mind, I don't know what I'm talking about.
No, that's okay. But they are still the deep swab that's not your brain, but So the deep swab that is, but from the people I've talked to, they're not that uncomfortable. We thought they were going to be more uncomfortable. They're not great, but they're. But you don't have to have an order to do it. You could actually walk up, and you don't have to have talked to a doctor about it. Now, having said that, we would love to have even a phone consult with you first to kind of determine, because maybe you need other testing done, maybe you have other stuff happening. So it's best to consult with your doctor first. But then the other part of it is you want to make sure to make contact with your doctor or your provider, because we want to make sure those results get to you in a timely manner. We want to make sure we know what the next steps are, because obviously you're getting the test because you don't feel good. So then what do we need to do next about that? Yeah.
And Miranda, this is a really good question. Why doesn't the health department share information regarding where positive cases were before diagnosis, such as were they at the grocery store, the bank? She had seen some counties were doing this earlier in the pandemic, but haven't seen it lately. We are doing a lot of contact tracing on those people that are positive. If I'm trying to figure out the best way to answer this, so contacts within 6 feet for 10 minutes or more, and honestly, that generally doesn't happen at the grocery store.
Or the bank, or any of those common places you might just walk by somebody.
Yeah, so they wouldn't technically be necessarily super, you don't hear of huge outbreaks at Walmart. Mm-hmm. You don't hear of huge outbreaks in those types of places, because it's very short intermittent contact. So we don't want in your business We don't.
That's a good way to say. Go for it. We don't want your business.
We don't want your business.
I mean, unless it's a colonoscopy, in which case, like, we're up
like
in your
everyone's
business,
in your business.
yeah.
But no, we hope that people are wearing masks to even further reduce the spread at like places like that. But yeah, we don't need to necessarily track down each one of those things, and it's the contact tracing's changed a bit since House Bill 2016, and there are some things that we are allowed to do, and there are some things that we aren't allowed to do anymore that we were used to be allowed to do. So, so that's why we're not doing that. It's not allowed anymore.
Can I say it? So basically, our House Bill 2016 that was passed during the special legislative session at the very end of the legislative session that they came in for, it actually kind of decreased the health department's abilities to do thorough contact tracing under the justification that they want to keep protect everybody's confidentiality and privacy. So that's great. We also want to do that. That's why we're not allowed to give out a lot of information about these patients. But at the same time, it does tie our health department's hands, because whereas they might have been able to share more information like that before, they're being told by the legislation that we can't. And so that's the truth of it. It's the legislation, it's the justification of it, and that's where we're living right now.
In the case of like the grocery store or things like that, it's not that big of a deal, because like we said, there's kind of intermittent contact. But when you go to some place where you're actually like if you're going out to dinner with someone from out of town or something where you would be a contact specifically, it would we would contact you, but not necessarily anyone else in the restaurant, just because we can't anymore.
And it is important. So if you do, let's say you do test positive, I mean, that's why, and I know Diane has been really good about, saying that she keeps track of where she goes, a couple weeks at a time, and just writing things down and who they're with, because we do rely on you to tell us who your contact was at the time, your contacts were. So the best you can kind of minimize, just socializing everywhere in the world, and limit your contact with people, that's going to make contact tracing easier. That's not to say don't go to the grocery store or the bank or whatever. Like Destiny said, when you do go there, it's short contact that isn't necessarily described as exposure. It wouldn't meet the criteria for exposure to somebody who's positive. So, right? Really with or without a mask, but with a mask on, it even further decreases that likelihood.
Yep.
Tina, I saw you had a follow-up question there. Are you prescribing over-the-counter meds? So that's kind of a tricky question, because we can't necessarily prescribe over-the-counter meds, but we are advising people to say use what you need for your symptoms. So that may be Tylenol, or maybe cold and flu medicine. It may be anti-diarrhea medicine, any of those things. So hopefully that answers your question, but it's really just over-the-counter stuff at that point. No antibiotics, nothing else really prescription, So.
Yeah, this as we go farther into this pandemic, our list of symptoms gets longer. Diarrhea wasn't on the list at the beginning. Loss of taste and smell wasn't on the list at the beginning. Basically, at the beginning, it was fever, shortness of breath, and cough, that was it.
Yep.
And now it's like the list just keeps getting longer. All these COVID toes. Whatever COVID toes is. Luckily, I'm going to knock on wood, because we don't know what that is, and we're going to hope we don't see it. But, there's a lot of odd symptoms that kind of come along with it.
And we'll keep track if there are more that they add on. We will let you know, but it's been pretty steady for the last couple of months, anyways, as far as our symptoms. So, but I would say if you are not sure and you think like, I don't feel right today, rather than assuming it's like allergies or something, but you don't normally have allergies, or rather than assuming you just, have a headache for some weird reason because you're stressed, rather than just assuming what's going on, if there's something weird that you don't feel right, your body best. So contact your doctor, contact your provider, and just say, hey, I don't know what's happening. Talk through this with me, and we'll work through it every time. Also, Destiny, you know, if you call out to the health department, they'll advise you probably to call one of us, but they'll help walk you through it as well.
Yeah.
So don't
and we
ever
have the
underestimate.
self-reporting form.
Oh yeah,
The
that's
self-reporting
true.
form. It's pinned to the top of the health department's Facebook page, and I think it's on the county website as well.
Mm-hmm.
And we actually got one of those today. You put your symptoms in, and you give them your phone number and email address, and the nurse will call you and say, tell me about, you know, what's going on, and kind of help walk you through it. And in most cases, we'll say, well, if you think you got it, go get tested. I mean, because we have that ability now. Now, when we very first launched that tool, we didn't necessarily have that. But, you know, if you just want to ask questions and you want to talk through symptoms with somebody, we're here. Your doctor's here.
We're here to talk.
Mm-hmm.
Chat with us, please. All right, you guys. Ooh, we're chatty Cathy's today.
We
aren't
are.
Yes.
All right, let's do last call.
Last call.
Last call for questions.
Last call. That reminds me, maybe don't go to bars. You know, right now it's it's a thing. I know the governor's talking about, like, if we see surges, are we going to close down bars? I don't know. I mean, and again, can counties overrule that? Probably at that point. In Wilson County, we don't technically have just bars that aren't restaurants. Mm-hmm. So, but we are seeing that at bars and places like that. We are seeing spread. So that's and that's throughout the countries and other countries too. So yeah. Oh, DJ Joe, Sausage Fest next year. We'll have to do it next year. So, anyways, oh, sports. That was another thing I thought of earlier. It's the brain hamsters. You know, they're slow. Sports. So CASHA, right? So they're the high school. They're the governing body of high school sports. Voted that we can go ahead and do high school sports at this point, junior high and high school sports. That is what it is, and you know, but we do know that sports like football, where people are in close contact with each other, are higher risk than, let's say, golf, you know, and maybe even higher, I don't know, volleyball, baseball. I mean, we have people in dugouts and things like that. Sorry, go ahead.
I was going to say travel for sports is going to be just as high of a risk as the actual sports themselves. And I have a kid playing a fall sport, and I told her, I'm like, we'll just see how it goes. And I think that's kind of the way everything is right now. Major League Baseball got like, what, a week before they had an outbreak. So
yep. So we know even the professionals with all the money in the world are still having trouble with this. So I just bring this up because yes, we can go forward with sports, and I do believe our coaches and our schools are really trying to make that as safe as possible. Just have those conversations with your kids, that when they're sitting around at football practice or at baseball practice, try to social distance. You know, if they're not ramming into each other's helmets, then maybe stand to the side. I don't know. I'm not good at sports. I'm not good at the sports thing. But so have those conversations with the kids to let them know that they still have to stay safe. There's nothing about being outdoors or being amongst other kids that makes it just completely safe, you know. All right. I guess we did our last call. I think just our friendly reminder is just be kind to each other, take care of each other, call each other, check in with each other. We appreciate, as always, all the text messages and cards and you know, just diamonds and jewelry that people are sending us. Wait, you didn't get it?
No.
Well, whatever.
No, I didn't get it.
So we appreciate everything that you guys do for us to keep us supported and going, and we do love your feedback. So we'll take it positive or negative, and that's okay. But please remember that we're all in it together. Take care of each other. Vote. Don't forget to vote today. It's the primaries. Mr. Fisher says, I've seen things for band where they are making coverings for their horns, like the cool sousaphone things, but for all instruments.
That's cool.
That's actually cool. See, it's all about innovation, people. Mm-hmm. It's really cool.
Well, and really, if COVID's taught us anything, it's that we can think on our feet.
We can get stuff done.
We can figure out a good way to do nearly anything.
Yeah. We're getting really good
I've
at
been
this
really
game.
impressed. I've been really impressed with all of our schools, because they are masters at hurdles.
Yeah.
I guess they see a hurdle and they're like, all right, here we go.
Yep.
We're gonna fix it, and they've been really great. So I've been incredibly impressed with all of our schools.
Yep, me too. All right,
All
you
right.
guys. Okay, take care. Vote. Be kind. Wear your mask. Also vote and be kind.
What time do the polls close?
I
You
think
know?
7.
7?
Maybe. Hopefully I'm not wrong. But vote. Thank you guys. Take care. We'll see you in 2
Bye.
weeks.